This is Nevada Cancer Coalition's Cancer Talks, a public health podcast where we connect with coalition members and partners to learn more about cancer prevention, early detection, and survivorship. Hear about cancer care in Nevada and meet the people who are making an impact. I'm your host, Kristen Hackbarth. Today, we're joined by Rebeka Acosta, a board member with Act for Kids Nevada, a voice for Nevada's children. Thank you for joining me for this. How about you introduce yourself?
My name is Rebeka Acosta. I am one of the founding board members of Act for Kids Nevada, and I'm also a board certified patient advocate. So I work with children and families across Nevada and around the country to navigate the health system and find the care and the services that they need to be their best and healthy selves. With Act for Kids Nevada, we are super excited. We are a fairly new organization at the end of 2023, formed by parents, advocates, and healthcare professionals just to represent children and families in the healthcare space in our state. We feel that parent and family and child voice has been largely left out of the healthcare conversation, and that definitely has not helped us out and in moving forward. So we really are working very hard to bring comprehensive healthcare to Nevada for children so that we can send generations of healthy and well-adjusted children into adulthood.
That's awesome. Okay, so you became a family advocate out of necessity. Tell me about that learning curve.
Yeah. So after school, my career in healthcare started on the business side, the administrative side. I worked in insurance companies, and in the accounting departments of healthcare systems, just that cubicle rat race on the business side of healthcare. And I thought, oh, I know how everything in healthcare works because I'm seeing it all from behind the magic curtain. And when my husband and I started our family, we adopted two children who had medical needs. And I quickly found out that I had no idea how the front end of healthcare really worked with kids with medical needs. So I took time away from work about 8 years to learn and help my kids get through surgeries, moving out of state temporarily to get care, having surgeries across the country, starting school and managing all of those things. And I learned so much the very, very hard way. And as my kids were going to school, and I said, okay, I think everything's calmed down, I could start to work outside of the home again. And I couldn't even imagine going back to healthcare administration. So I was like, how can I take everything that I've learned and share it with other people? I don't want to gatekeep this. Like, this is need everybody needs to know this. This is life or death information. And so I started just reaching out to other people I'd worked with over the years and volunteered with. And I learned about an organization who had created the board certified patient advocate credential. I started studying because I am very far removed from having been in school. And in 2018, I was in the second group of people who passed the board exam for patient advocacy. And then from there, it just took off for me. I'm like, how can I help families in my neighborhood, in my town, in my state? And I just started talking to people, asking them about their problems, going with families to doctor's appointments so that parents could understand what the doctors were saying about their child's needs. And it just kind of blew up in a couple years. People were stopping me at the grocery store, texting me on my cell phone, I need help. This is happening. Our insurance just terminated, or our doctor is retiring, and now there is nobody here in this specialty. What do we do? So I really like to tell families that my very first clients were my kids, and they were my number one teachers. So I do this at work and I do it at home. And my kids have survived. They're teenagers, almost adults now. So something must be going right.
That's amazing. So you said that you will go to doctor's appointments with families. What are some of the other things that you do as a board certified patient advocate?
It's a lot. Depending on what children and families need really dictates how I'm involved. Sometimes families reach out to me because their child just got a diagnosis and they are just overwhelmed. They heard whatever word of the condition and they don't know where to begin. And so I do some health education about the specific condition and connect them with resources in the community. Maybe there's a support group for families of children with that condition. Maybe they need to plug into speech therapy, physical therapy, some other type of health service, like get them connected with that. Maybe they need to build a whole new medical team now that they have this condition. So we help go through their insurance and find out what's in their network and get them set up and started. And then a lot of times, which is my absolute favorite part, I work with the kids too as they grow up to teach them about their condition, what that means for the rest of their life, and then teach them to use their voice as the expert of their body and to advocate for their needs. And for me, that is my absolute favorite part of being an advocate because you're not only changing that kid's life, right? They're gonna teach their friends. They're gonna teach their children and families and loved ones as they grow up, and you just that's that ripple effect of, "I have this condition, it's one part of me. I am the expert. I will tell you what I need, and you're my doctor or my other care provider, and we're gonna work together, but I'm in charge," kind of that to me is a game changer, especially when for kids, we don't have this comprehensive health system in Nevada for kids. It's imperative that kids, to their best ability, be able to use their voice and speak up for themselves. So that is my absolute favorite part of being an advocate.
You touched on it, and I think the first time that we connected was really about the fact that we don't have a lot of pediatric providers in Nevada. We
Mhm.
are short in a multitude of specialties related to pediatric
Yep.
care. And in Nevada, we're always saying it's different here. We're different than other states. And
Mhm.
in many cases, that's true. But when it comes to healthcare for children with serious or complex medical concerns, it really is different. So, what
Mhm.
are families experiencing?
Oh, wow, that's a huge question. Like I mentioned, my kids both have complex medical needs, and we have traveled out of state. My now 16-year-old, all of his care is out of state because the specialists are not here in Nevada. I mean, we're actually every year we spend our spring break out of state at the Children's Hospital where he has all nine of his specialists, and we can see every single one of them in 2 days and get everybody on the same day. All talk to each other. There's a comprehensive treatment plan, and then we come home and we execute it with his local pediatrician. And that is not the case for the majority of families in Nevada who have children with complex needs. They are cobbling together the best they know how, the best they can, and based on what their insurance coverage allows for them. So some insurance policies won't allow families to travel out of state. They can only see a Nevada provider. So they are left waiting in months, sometimes a year-long wait list to get a diagnosis or several months waiting for to start, ABA therapy or speech therapy, which, as we know, as parents and people involved with children, those months you don't get back, right? Those are gone.
No.
That development has passed. You can't go back in full whole. So just to wait 3 months for a child to start some kind of treatment or therapy is just mind blowing to me. And that's what families are looking at. That is the norm. Several months to get into a specialist, whether that's ENT or GI. So your kid is just supposed to struggle for 6 months or so before they can address their medical needs. As an adult, that would be like, if I'm having severe stomach issues, I can't wait 6 months, but we're asking our children to do that, and that's affecting their school, their social development. It affects the families. Their parents are taking off work, spending more time away from work. It's a community problem. So when we can't take care of children and families, it's everyone's problem. We all suffer in some way. And so I think in Nevada, yes, we are different from other states, but we're all still human beings. Kids and families and all of us need access to comprehensive health care, period. Yeah.
You're so right. You're so right. And I uh, to think about how many children I mean, we're the Cancer Coalition, so for us, we focus on cancer, but
Mhm.
there's children who are facing all sorts of different diagnoses, including cancer, and cancer is just
Right.
one of those things, and to have so many children in our state that are waiting, and they're getting older, and you're right, you can't get that time back, and I remember when I was a kid, 3 months seemed like an eternity. For adults, we think, "Oh gosh, the time where does the time go? Time goes by so quickly." But when you're a kid, 3 months is a long time.
That's the entire
And
summer break.
yeah, so
Yeah.
to be dealing with not feeling good and to be waiting for a doctor and losing those developmental times in your life and losing out on the fun of being a kid. Really, it's a huge disservice to children and to their families. And we really need to figure out how to get more pediatric providers here in the state so that we can better support. our kids.
Absolutely. Absolutely. Come work in Nevada.
So you are helping to organize with Act for Kids Nevada this family workshop, this family
Yes.
engagement workshop. Tell me a little bit more about that.
Yes, we are so excited. So it is happening on Saturday, March 7th in Las Vegas. So this first one is for the Southern Nevada families. And don't worry, we are planning one in Northern Nevada later this year. We just have to get through one before we can start the next. So on Saturday, March 7th, we are inviting families of all kinds to join us in an afternoon of just learning how to engage with all of the systems that you need to when you have a child with medical. There is no class except for ours that you can take, right? Like, we know that this is advanced parenting. This is dealing with doctors, dealing with school nurses or other people on the school team. This is dealing with physical therapy, speech, just insurance. Like, the amount that comes at you when you have a child with medical needs is just absurd. So we thought, what best way can we share all of our experience and our tips and tricks and also connect families to those in the community that do this work and that can help them in the different systems. We're like, well, we know all these people. Like, we can get everybody in a room. We can bring families together and let them hear from these experts that yes, you do need to engage in all these systems. You are your child's number one advocate until they can do it for themselves. And we're going to help you. We're going to explain how each part works, how they work together. We're going to give you the foundation so that you can figure out the right starting place for your family and your child's needs. Whether that means you need to get a new medical team, and now you've heard from the pediatrician we have coming that yes, they want families to have questions for the doctor. They want them to propose solutions. They want to hear about the child's struggles at school with XYZ, with these developmental stages. All of it matters. And then we have someone who is an expert in special education who is going to talk about how having a child with medical needs affects their learning and development at school and how to talk with the different team members at school, what they're called, the different language between healthcare and education. We also have one of our wonderful parent advocates on our board is going to do like a smaller version of our storytelling workshop that we post before online, just to help families boil down everything that's ever happened with their child into like a 3-minute story that they can use to share with the media. They can come to a legislative session and share their story on a specific policy. They can just better be prepared to give a quick rundown of their kids' medical needs and diagnoses to a new doctor. I just think it's going to be a really well rounded opportunity for families to just put all the crazy pieces that are flying around into one bucket and learn how it all works together and to best advocate for their kids. I'm super excited. I was actually working on all of the slides and everything just before we got to talking, and it's gonna be really great.
It sounds like an amazing opportunity. I think that it would benefit so many people, even if they weren't necessarily dealing with a
Mhm.
family, a child with a complex medical condition. I think a lot of people could benefit from understanding those sorts of things, people who've undergone trauma, traumatic injuries and that sort
Mhm.
of thing. It it's one thing. This is probably another big question for you, but it seems really unrealistic, though, to train every family on the ins and outs of the healthcare system, especially
Absolutely.
with a changing healthcare system,
Yes.
and how to advocate for their children during really emotionally stressful times. And so what do you think needs to change to improve the system and ensure
Oh,
that every child or even every person diagnosed with cancer or some other complex medical condition gets the care that they need?
that you're right, that is a very big question, but I'm really glad you asked because those are some of the other pillars of the work that we're doing at Act for Kids. So not only are we supporting families, engaging with them, teaching them what we know and what they need to know, we are also working with other organizations in the community that do similar work. And we're also working in the legislature to advocate for policies to create this comprehensive system for kids. It is not something that we can wave a magic wand or win the lottery and throw all the money at. It is definitely changing the infrastructure of our state's healthcare system, but we are in it for the long haul. Like, we know that a freestanding children's hospital is coming to Southern Nevada. That is not the cure all for all of our issues, right? That is like step number one. And so we are really focused. We make sure we explain to everyone we work with that we want that comprehensive system. It's not just a building. So once the building is here and it's open, now we need all of the pediatric health providers across the state to tie into the make this network so that we all know where to send kids with XYZ needs. When a kiddo is diagnosed with a type of cancer, this is where you start. Here's your network of services that are available. Here's the support systems, all the things. So we're going to be doing this work for decades and decades to come, but it's crucially important that we understand that we are creating this safety net for kids. Like there to say a one-stop shop, yes, in theory is correct, but, like, it's not just a one building, it's that whole invisible safety net of every type of provider that will help or support a child and family throughout their health. And it's a lot, and right now it's very fragmented and siloed. We have, I'm in Southern Nevada, so in Las Vegas, there's, I don't know, 7 hospitals, 8 hospitals, adult hospitals, and most of them provide some variation of pediatric service, right? So, like you mentioned before, children with cancer and other diagnoses. That's a big issue that an example I use a lot for my kiddos are in the pediatric cardiology space a lot, and we have friends that have heart conditions and have had heart surgery and get seen at one hospital for that care, and then they're diagnosed with cancer, and they have to go completely across the valley to a different hospital for that care. It doesn't sound like that big of a deal, but then you consider all the downstream effects, like those doctors don't communicate. They're in completely different health systems. The records don't talk to each other. They don't share. If they want to give one set of records to the other provider, the parent has to get them on paper, drive them across town and deliver them. Then those have to be scanned into theirs. It sounds almost silly when I say it out loud that we're still dealing with these issues in 2026, but that is the reality for so many families. Even families who have children who are healthy and they only see the pediatrician once a year for a well child visit. I am so happy that that is the case for your child. I wish that for every child, but you are only one car accident away from that not being a case or one scooter bike crash. It is so imperative that we have this safety net comprehensive system for every child, no matter how complex or not their medical needs are, because that is how we create healthy, well adjusted, balanced children to send into the adult system because they don't stay kids forever. Whatever we are not addressing in a child's physical, mental, and behavioral health, we are sending that with them to adulthood. And now the adult system has to deal with it, which it is not equipped for. And so it is to everyone's best interest, like I said before, that we take care of children and families when they need it with the full support and services so that we're not burdening the entire network of everything that we have in our state.
Yeah. It seems ludicrous that in this day and age, you would be driving reams of paper from one medical
Mhm.
facility to another just to get, I mean, truly, that is not portable. That's not portable healthcare records.
No.
That is healthcare records that you can move from place to place. But when you think about what could go wrong there, I mean, they miss one sheet of paper. They they have, I mean, there's so much opportunity there for human error, and the fact that you don't even have doctors talking to each other from different
Mhm.
systems, it's just
Yeah,
so
and
frustrating.
I hear a lot from our general pediatric providers, the pediatricians in Southern Nevada who, let me tell you, are working talk about under-resourced, understaffed, under everything. Pediatric healthcare has just a shortage of every single role that you can think of, but it is crippling the doctors as well. They can't be the true healthcare medical home for these kids because they can't talk to anybody else, right? You can't expect a pediatrician to manage a complex healthcare needs and know that they're going to this specialist and then, be able to read that report and consult with this doctor over here. Or maybe they do need to go to a different state that has a very specialized service, but they can't communicate with those doctors out of state. They can't get records. It's like tying the pediatrician's arms behind their back and putting a blindfold on. It's really, really difficult to do their job from my parents' perspective. So really, when we talk about this comprehensive safety net, it's for the benefit of everybody, the kids, the families, the people who are providing their health care and those health support services. We all need this comprehensive network.
So true. So true. So, is there anything else you want to leave with
Oh my
listeners?
gosh. For the parents and caregivers out there and anyone who knows and loves a child, use your voice. I know it's so hard and you're overwhelmed and you're taking care of a kid's medical needs, you're going to school meetings, you're paying rent and putting food on the table, you're working. It is so much, but please, you're not alone. Share your story. Come to Act for Kids. We love meeting new families. We are collecting all kinds of stories to use in public awareness campaigns, in our legislative work. And we also have a number of other different ways you can get involved by completing surveys. So we collect data on your experience with pediatric healthcare. Just find a way to get involved so that this is not all consuming. Meet other families that have kids with medical needs. Come hang out with us on March 7th. We're also having another event for families on March 31st, so check us out. Yeah, just be involved and use your voice because your voice is the expert here.
Yeah. Well, thank you so much, Rebecca.
Oh,
I really appreciate you joining us for our very first podcast.
oh.
And we'll be sure to drop the link to Act for Kids Nevada into the show notes. And until next time, thank you.
Yes, thank you so much.